Have you ever stopped to think about how easy it is to violate HIPAA without meaning to? Sometimes it only takes one small mistake or a moment of distraction. And in healthcare, those moments can have serious consequences. I'm Kayla with Jotform, and in this video we will walk through what HIPAA is, what an accidental HIPAA violation looks like, and the most common unintentional mistakes healthcare organizations make. We will also cover ways to prevent these issues and how Jotform can help protect patient information. Let's jump right in. Since HIPAA became law, there have been hundreds of thousands of registered complaints related to HIPAA violations. While it's difficult to know how many of these violations were accidental, unintentional HIPAA violations can carry serious penalties. Good intentions do not remove responsibility, which makes awareness and prevention essential. An accidental HIPAA violation occurs when a patient's protected health information is accessed or disclosed unintentionally, compromising their privacy. PHI includes medical records, test results, prescriptions, and other information related to a person's treatment or health condition. It also includes identifiers such as social security numbers, email addresses, phone numbers, names, birth dates, and health plan numbers. If health data can be linked to an individual, it is considered PHI. Many unintentional HIPAA violations happen when PHI is shared without realizing it or when employees are not fully trained on HIPAA requirements. Let's look at some of the most common examples. One frequent issue is improperly disposing of PHI. Throwing documents with identifiable patient information into regular trash or recycling bins can lead to unauthorized access. PHI should instead be placed in secure containers for shredding or destruction. Another common violation includes accidentally sharing PHI using email or social media. A provider or staff member may post something that feels harmless, but still violates HIPAA rules. For example, sharing a patient photo along with a success story or posting a staff photo that shows patient information on the screen in the background. Even emailing PHI with good intentions can be a violation if it's not done securely. PHI can only be shared this way if the patient has provided written permission. Sending emails containing PHI to the wrong recipient is another unintentional violation. A mistyped email address or an incorrect contact selection can result in unauthorized access if the recipient is not approved to view the information. The same risk applies to physical mail. Sending patient records, billing statements, or other PHI to the wrong address can expose sensitive information and violate HIPAA rules. Faxing sensitive patient information in error is also a concern. Accidentally sending PHI to the wrong fax number or allowing unauthorized individuals at the correct fax location to see it can result in a violation. Lost or stolen unencrypted devices are another common source of accidental disclosure. Laptops, smartphones, and tablets that contain PHI can expose patient data if they are lost or stolen. This often happens when organizations allow staff to use personal devices without proper security protections. Employees accessing patient information without authorization is another issue. Whether out of curiosity or by mistake, accessing PHI without a valid reason violates patient privacy and confidentiality. Another common mistake is overlooking the minimum necessary information standard. HIPAA requires that only the minimum amount of PHI needed to complete a task is used or disclosed. For example, a provider may need to access a patient's medical history, but not their social security number. Sharing unnecessary details violates this standard. Failing to properly secure patient information can also result in violations. Leaving PHI in public areas like cafeterias or waiting rooms can allow unauthorized access. This includes transmitting PHI over unsecured Wi-Fi, using unencrypted USB drives, or sharing patient information through text messages. Not logging out of computers is another risk. Leaving a workstation unlocked or logged in can allow unauthorized individuals to access PHI, even if the employee steps away briefly. Inadequate employee training is one of the biggest contributors to unintentional HIPAA violations. HIPAA requires that healthcare employees understand privacy and security practices. Without proper training, employees may not realize that they're violating the rules. Accidentally disclosing PHI in conversation can also lead to violations. Discussing patient information in public areas where others may overhear, such as hallways, cafeterias, or waiting rooms, can unintentionally expose PHI. Other unintentional HIPAA violations include failing to provide a notice of privacy practices, neglecting to obtain business associate agreements for third-party service providers, and adding patients to newsletters or mailing lists without consent. Even when violations are accidental, they can still result in serious consequences. Depending on the situation, unintentional HIPAA violations may lead to fines, sanctions, job termination, reputational damage, and loss of patient trust. The good news is that organizations can take steps to prevent unintentional HIPAA violations. One of the most effective strategies is providing ongoing HIPAA training to employees, contractors, and volunteers so everyone understands their responsibilities. Organizations should also implement strict access controls to limit who can view PHI and use encryption to protect data. Performing a comprehensive risk analysis at least once a year can help identify weaknesses before they become problems. Many organizations assign a privacy or compliance officer to answer questions, provide guidance, and conduct risk assessments. Clear protocols for handling PHI should also be in place, such as not using personal devices for work, not leaving files unattended, not sharing login credentials, not texting patient information, and being mindful of where patient conversations occur. Jotform's healthcare templates and data collection tools are designed with security in mind, making them a helpful option for healthcare organizations. Jotform's HIPAA-friendly forms allow providers to securely collect, store, and manage PHI while meeting healthcare compliance requirements. Data is stored on secure servers. Jotform also authors healthcare form templates for patient registration and medical history collection, along with healthcare tables for tracking progress, medication schedules, and more. Free healthcare app templates allow staff to collect information on desktop or mobile devices, while approval templates help automate internal workflows securely. Thanks so much for watching. I'm Kayla with Jotform, and I hope this helped you better understand how unintentional HIPAA violations happen and how to prevent them. Be sure to click subscribe for more helpful insights, and we'll see you next time.